connect employers with qualified, skilled talent and job seekers with employment and career development opportunities. Tune in the first and third Wednesday of each month at 9:30 a.m. to Career Source, Citrus, Levy, Marion, and learn how they can help you.
Thank you. 26 minutes before 8 o'clock. Beautiful Friday morning. 74 degrees here at the studios at the Paddock Mall. Looks like we've got a nice day ahead of us. I actually don't see any mention of rain in the forecast. Oh, yes, I do. I'm sorry. There's a 20% chance. Well, that's kind of normal for this time of year, but I guess that's lower than we've been seeing all week long. The weekend looks pretty nice as well. So my dog has not been feeling well lately, and so she sleeps next to the bed. Well, she's been sleeping next to the bed for a while anyway, but anyway, so I was just kind of making sure she was okay, and I rolled over before I fell asleep last night just to kind of pat her and say, yeah, everything okay with you? You know, and when I rolled over, I felt this thing in my back. I felt like, oh no, because you know how you can feel like you've just done something, so then you kind of backtrack so that whatever you did, you can undo before it becomes a problem for you that you have to deal with for the next couple of days.
Yeah.
I've actually been pretty blessed in my lifetime, knock on wood, that I haven't had a whole lot of serious back pains, but I know many of you have. I know Joe's had his share of serious back pains. Dr. David Greenwald is on the phone. He's an expert on lower back pain, specializing in neurosurgery and based at the Flagler Brain and Spine Institute in the St. Augustine and Jacksonville area. He is on the phone to talk to us about the trends and symptoms of back pain sufferers and back pain surgery versus non-intervention treatment. And there's a word in here I'm going to take a shot at. It's sacroiliac. Is that right? Sound right? Sacroiliac joint dysfunction, chronic lower back pain. Dr. David Greenwald. Good morning, doctor.
Good morning.
Did we wake you up?
No, not at all. I'm waiting for surgery right now.
Oh, my goodness. You're at the hospital?
Yes.
Oh, my goodness.
I'm doing a neck surgery and when I'm done here.
Oh, gosh. Wow. It's amazing what doctors do. See, we think we have a hard job.
Yeah.
He's got to cut into somebody.
Yeah, that's right. That's right.
Oh, man. So, oh, wow. I'm not even going to ask about the person. I guess there's a HIPAA reason I can't ask those questions anyway. Not that we'd know anything about the person. But anyway, well, thank you for being on the air. How did I do with that word, by the way, sacroiliac?
You did very well. That's what it is, sacroiliac joint.
What is that?
Well, the pelvis, which is, your spine ends in the pelvis and your legs emanate from the pelvis. So your pelvis is critical to your spine and to what a lot of people perceive as back pain. So your pelvic, so sacroiliac joint are the two large joints in the pelvis, in the back of the pelvis that support your spine. So patients who have, about 80% of patients will have back pain at some point in their life, and 25% of chronic back pain patients, really, the pain is really coming from the sacroiliac joint, not the back itself, but the patients don't really know that.
Oh, really?
Yes.
And
so it's a very common problem.
And we feel it in the lower back, like just the both?
So if you have a sacroiliac joint problem, you'll feel it below your waist on one side, so it's usually much worse on one side than the other. The patients will often point to it very, very clearly. They'll put their finger right on it. So it's usually below their waist in the upper buttock area.
Do we sometimes confuse that with, like, kidney problems?
No, it often gets confused with disc problems or facet problems.
Oh, okay.
And often patients will get the wrong surgery. That's the problem with it, is that a lot of patients who have sacroiliac joint problems also have hip problems. They also have back problems. And in the workup, they'll be found to have a disc problem, and they'll get surgery on the disc, and it'll actually make their problems worse because the pain is really coming from the SI joint itself. So SI stands for sacroiliac, so that's what we call it, the sacroiliac joint.
And do the patients, before they go to their doctor, try to self-treat, and is that a bad thing?
Yeah, absolutely. So, most patients who have back pain, the first thing they'll try to do is rest. They'll try to, take some Motrin or Advil, and then if it persists or it's getting worse or it's affecting their ability to go to work, that's when they'll usually see a doctor. And conservative treatment for all back pain it really should be performed before anybody considers anything serious like a surgery. So, and that would be physical therapy, an injection, stronger medications. activity modification, those type of things.
Does the surgery actually fix it, and the other things kind of mask it, or not really?
Surgery actually will fix it for sure, because it's a structural problem. So once the patients who end up needing surgery for sacroiliac joint problems are patients who've have had problems with their SI joint for over a year. They have tried and failed all forms of conservative treatment. As I said, activity modification, physical therapy, medications, and injections. And it's a very debilitating pain because it occurs, unlike discogenic back pain where the patients are relatively comfortable laying down. Patients with sacroiliac joint pain are very uncomfortable laying down because turning in bed is excruciating for them and will wake them up. And sitting is very difficult with SI joint pain because you're sitting on your pelvis. So driving is really the worst thing for patients with SI joint pain. They have a difficult time driving anywhere.
Is it the kind of thing that if we don't take care of it, it gets worse?
Yes, absolutely. It has to do a lot of it with, we're designed for symmetry, but we really don't live symmetrically. We, tend to favor one side or the other, or we have problems with one leg, one hip. We overweight the other leg, and so over time, it's the chronic asymmetry that tends to, precipitate the problem.
The people that are extremely active athletically, do they suffer any of this, or are they stretching so much that they don't have to worry about getting it?
It can affect, the SI joint problems really affect everybody, women, men, young, old. It can be precipitated by activity, particularly heavy lifting in front of you, like lifting something up in front of you. That's a common source of the pain. Motor vehicle accidents. So, obviously being fit always helps. The more balanced you are, front, back, the stronger your core muscles are, the better you do from a back pain perspective. But it can really occur even in very fit patients as well. If there's often a traumatic etiology to it. Just lifting wrong, or as you described this morning, just turning in bed wrong.
Yeah,
can activate it.
So I'm guessing that if we have an unhealthy lifestyle and we're obese, that extra weight must take its toll on that. I mean, not to mention
Absolutely.
the other things. Okay.
Yeah.
Will this affect the heart at all?
Well, obviously, if you're in a lot of pain, your stress levels go up, and that's very, very bad on your heart. And if you're unable, people who have severe SI joint problems really end up being completely inactive because any activity really exacerbates the pain. So they, obviously inactivity is terrible for your heart. So secondarily, yes, it can affect the heart.
You sound so calm. I mean, if I was going to be cutting into a person's neck after the interview, I would be on edge.
Yeah.
But you sound like the world is okay. Everything's fine.
I do 400 surgeries a year. So.
Wow.
Oh my goodness.
Wow.
Including brain surgery. So.
Oh my gosh.
Oh gosh. Holy mackerel.
There
I
you
actually trained there in Gainesville, very close to you guys. So.
Oh, you do?
Did you really?
Oh
Yeah.
my
What was it like
gosh.
the first time you had to cut into somebody's brain? That must have been scary.
Yes, no doubt. That's why it's a 7-year training, so you got a lot of time to have people watch you along the way and make sure you don't make the wrong cut.
If people don't get their back pain taken care of in the right way, does that decrease their lifespan?
Absolutely. I tell my patients, we're like sharks. Sharks need to swim to live. You need to walk to live. So, if the more you walk, the longer you live. And so anything that takes away your ability to be active is going to shorten your life significantly. And that's really the goal of our surgeries, is to take people who are unable to be active due to pain and take away their pain so that they can get back to a normal level of activity.
Wow. So does one cause the other? Does inactivity cause lower back pain?
It does, absolutely, because back pain can come from the muscles that support the spine, and so inactivity rapidly weakens your core muscle strength. Can come from the discs that support the spine. the facet joints in the back of the spine, the nerves that can be compressed in the spine itself, the sacroiliac joint. So, activity is, and done correctly, is critical to spine health.
I'm guessing that the listeners who have turned up the volume to hear this conversation want to know a website or a book or some information that will lead them to be able to ask more questions or get more questions answered. Do you have a website or something to pass on to the listeners?
Yes, there's one of the great new treatments for patients who have chronic, long-standing pain. There's a new operation we've been doing for a couple of years from a company called Zyga, Zyga, and they have a great website called www.zyga.com. It talks about SI joint pain in great detail. And in that procedure, we place 2 titanium screws across the joint after we prepare the joint and put some bone graft in the joint. And the operation takes under 45 minutes. Patients go home the same day, and it's permanently fixed. So it's a great procedure. So that's a great website to look up for SI joint pain. There's another great website called www.understandspinesurgery.com, which really talks about all possible spine procedures that can be done. And I often have my patients go to that site when, after I've discussed the surgery with them, so they can, look at the procedures in more detail on their own time.
Okay. So understandspinesurgery.com and Zyga, Zyga.com.
Exactly.
Those are the 2.
Those are the 2.
All right. Titanium screws. That just sounds so...
Science fiction.
We use titanium because it's non-magnetic, so you can have an MRI after you have it placed into your body.
Oh.
And it's a very lightweight, very strong metal, and bone is attracted to titanium, so you get a good bone screw interface with titanium. And it's resistant to infection, so it's really a terrific product for us in spine surgery.
It's the first time anybody ever said "get a good bone screw interface" to me.
That's right.
I never heard those words before.
I always say, I tell my patients, nothing heals like steel. So.
Oh, I love that.
Well, you're a fun doctor. You are the most relaxing guy I've ever spoken to.
Hey, nobody wants a nervous surgeon. Right?
I'm going to be cutting into a man's neck in a little while, and I've done 400 of these a year. So
Yeah, so I'm okay.
well, you're fun too, Doctor. Are you in Jacksonville or St. Augustine?
I'm in St. Augustine, Florida.
All right, I love that city. Dr. David Greenwald, thank you for being on the air with us. For the listeners, the websites again are Zyga.com and UnderstandSpineSurgery.com.
Thank you so much.
Thank you, Doctor. All right, we will take a little break. We'll be right back.
Thank you so much.
The weather is brought to you by myfwc.com. Safe boating is no accident. For today, partly sunny skies. There'll be a thunderstorm in spots mainly this afternoon, the high 91 to 95. Partly cloudy tonight, low 70 to 74. Tomorrow, partly sunny with a thunderstorm around in the afternoon, high 91 to 95. And for Sunday, partly sunny with an afternoon thunderstorm likely, the high 92 to 96. From the Florida Weather Center, I'm meteorologist Joe Lundberg.